In the next 5 minutes, you'll know exactly when to use heat versus ice because using the wrong one at the wrong time can actually make your pain worse. When determining which modality to use for your pain or injury, we're essentially looking at two main things. First is what stage of tissue healing or recovery are you currently in? So for example, did this injury or pain start yesterday, or have you been dealing with this issue for months? So it's a little bit more chronic in terms of the timeline. And also we want to see what specific pain or injury are you having? Is this the type of pain where maybe yesterday, for example, you just picked up something heavy from the floor and now you're starting to have some pain in your back? Or is this some kind of pain where maybe you either just had surgery or you're having soreness, like muscle soreness from a workout? So determining the timeline and the actual cause of the pain is going to help us really decide which modality of cold versus heat is going to be more beneficial. When implementing cold therapies, such as ice packs or ice machines, we want to focus on the timeline where we implement ice or cold during the early stages of tissue healing or in the early stages of the injury. So for example, let's say if you just injured your lower back yesterday, you're within the early stages of recovery. Now that first 24 to 48 hours is going to be very crucial to bringing down inflammation and swelling. Now with ice packs, that's going to help reduce the pain, reduce the swelling and inflammation. It's going to cause that vasoconstriction. So a lot of those blood vessels are going to close up or vasoconstrict, which prevents any more accumulation of fluid or of swelling to that area, which will allow that tissue to heal better, right? Now, in addition to icing, like in the acute stages of an injury, so that first 24 to 48 hours, there are situations where you're going to be icing beyond that. So for example, with total joint replacements or really any type of like surgery, especially to a joint, like the knee joint, for example, you're going to have a significant buildup of edema or of swelling in the knee. So we want to bring that down as quickly as possible. Now, because like a joint replacement to the knee is pretty significant, that's going to take a longer period of time to reduce the amount of essentially like tissue damage or trauma that was done to the knee. So icing is going to be pretty continuous throughout the recovery process that first month. So instead of just the first 24 to 48 hours after the surgery, typically people who have a total knee replacement are going to be icing for at least a month pretty consistently. So that's for heat. We actually want to use it during the later stages of recovery or of tissue healing. So for example, when we're trying to improve circulation or blood flow to a specific area, heat is going to cause vasodilation, which opens up the blood vessels and allows circulation to increase, and it's facilitated. So with a lumbar or a low back strain where you're 6 weeks since you initially lifted something heavy and you start experiencing low back pain and primarily your lower back muscles are injured, at that point, the 6-week mark, we definitely want to be incorporating some type of heat modality so we can improve the circulation and blood flow to that soft tissue that will actually help with the healing at that point. On top of that, we also want to use heat when we're just trying to increase circulation for physical activity. So for example, if you're about to go play a sport or engage in some type of physical activity where you're going to be moving and using a lot of different muscles, you want to go into that activity with increased circulation, increased heart rate so that there's more blood flow in the muscles that you're going to be using so that they can perform more efficiently versus if you were just to jump straight into a physical activity while very cold and with poor circulation. Some of those muscles aren't going to be as effective early on unless they're warmed up properly, right? So heat modality can help increase circulation when you're about to participate in some kind of sport. Additionally, diagnoses where you experience lack of range of motion or mobility deficits such as joint stiffness or tightness or contractures in joints or muscles, you typically can improve that and facilitate greater ranges of motion by using heat. So that vasodilation that improves blood flow and circulation will actually allow the tissue to be more essentially compliant, more flexible, so that improves its range of motion throughout the joint. When using heat or ice, typically you're going to be in a seated position. However, if you sit for too long, that can cause hamstring tightness, which ultimately can lead to hip and low back pain. If this sounds familiar, watch this next video where I go over specific exercises that can help reduce hamstring tightness and related pain.